we collaborate with each other and doing this project, because actually I'm doing the vascular biology. So actually, why doing this project is actually because that, so in the clinic, so they found a lot of patients they treated with ibrutinib. They have, I think they have the adverse effects, especially the cardiovascular disease and including the hypertension. So these patients in Chinese actually, so it's actually in the single center in Nanjing Medical University. So it's affiliated hospital. They found that at least 30% of patients have the hypertension after 1 or 2 months when they treated with ibrutinib. So, but we found we also found that a little bit of the work to study this mechanism, such as the SEC signaling. But I think we should have some different signaling or pathways to mediate those so high incidence of hypertension. So actually, we're doing this project. So when we're doing the project, we firstly use the animal model. We use the mouse. We give them the oral administrated with ibrutinib for about 1 month, 4 weeks. Actually, after 4 weeks, we found the mouse have a higher systolic blood pressure. It's about, I think it's about, it can reach about 140 mmHg. So it's actually much higher than the control mice. So firstly, for this situation, there should be some many different kinds of the problems. So then we isolate the resistant arteries, mesenteric artery actually. So we isolated the artery and to see the morphological structure. So, but we didn't find no structure remodeling. So that's very interesting. So we think that if have no structure remodeling, should be have the other remodeling, such as electro remodeling. So actually, we then doing that. So there is one kind of the ion channel that's called the CaV1.2 calcium channel, because we focus on this ion channel for decades. So then we firstly we isolate the mesenteric arteries from the ibrutinib-treated the mouse. Then we doing the Western blotting and the RT-PCR something else to check the expression level. Then we found that this calcium channel is actually upregulated. So then we also doing the electrophysiology, like the patch clamp. Then find the current density. That means that the current size of this calcium channel is actually increased. So this and not only the current size, but also this window current, or that is IV curve, is actually the very physiological parameters to shift to left hyperpolarization. So that means when the IV curve shifted to hyperpolarization, that means this channel can be opened easier. So once it is further easier, so maybe it will make the stronger contraction of the smooth muscle. And this is confirmed by the intracellular calcium concentration. Actually, yes. So we found that this is actually a phenotype, but we also to find out the underlying mechanisms. So that means how this ion channel is upregulated. Then we're doing the RNA sequence, then to find a very important transcription factor, CEBP beta, is actually increased. So this CEBP beta, it can be bind with this calcium channel and make this calcium channel is upregulation. So, and we're also doing some biochemical experiments such as the GIP or something else to confirm with that. But of course, this is a preliminary data, and of course we need more evidence to support our idea. But from here, we know that some calcium channel may be a target for mediate the hypertension or higher blood pressure in ibrutinib-induced patients, treated patients. So that's actually our the preliminary idea or story for this project. The not is only focus on the functional study, but we didn't not dig out the very molecular levels. So then next step, we will use some biochemical or some mutant genetics to check this CEBP beta transcription factor, whether it can mediate the promotion of this expression. So I think we need to going back to the clinical. Then we will check the patients if we can collect some human samples from the patients. Then we also check this transcription factor and calcium channel expression level. And of course, we will using some knockout CEBP beta knockout mouse to confirm our conclusion. I think maybe so. So for the clinical significance, we can use some calcium channel blockers to treat this kind of patients, because we found that the calcium channel function is upregulated. So maybe for this kind of patients, antihypertensive treatment, the optimal treatment may be using the calcium channel blockers. Actually, we now collect some clinical data from the hospital. So then to compare with the calcium channel blocker or something other, maybe ARB or ACEI drugs, to which kind of the treatment has more effective. But from our animal study, we got the conclusion that maybe calcium channel blocker, especially for DHP drugs, maybe have the benefits for these kind of patients. So that's our primary conclusion.